All right, welcome everyone to our panel on bird flu and how to cover it responsibly. So, hi everyone, I'm Catherine Fine. I'm the 2024 to 2025 Civic Science Fellow at the Center for Cooperative Media, funded by the Rita Allen Foundation. If the term civic science isn't familiar to you, I'm sure you're not alone. It's a relatively new discipline. Basically, what civic science is, it's a discipline that aims to democratize scientific endeavors and facilitate their integration into policymaking, civic involvement, and political transformation. And one way to bridge this gap is through journalism. And I've been spending my fellowship exploring how journalism can serve as a conduit for taking science into practice. So to start, let's just rewind a little bit to 2020 to put the bird flu in context. So as we're all aware, I'm sure the COVID-19 pandemic intensified pre-existing skepticism and hastened the emergence of science skeptics. The COVID-19 pandemic accelerated the pace of scientific publishing, leading to a surge in provisional or incorrect information. This rush, paired with growing politicization, further fueled misinformation. As noted by Ryan Cross in Chemical and Engineering News, in the middle of the crisis, quote, "The confluence of rapidly evolving science, mixed messaging, misinformation, and flagrant politicization in the US created a perfect storm for eroding trust in science." I think he put that really nicely. The pandemic also accelerated the scientific process, laying bare its expedited outcomes for scrutiny. And another quote that I thought conceptualized this nicely is from Dr. Vishwanath, professor of health communication at the Harvard T.H. Chan School of Public Health. Quote, "All of a sudden, everyone is watching scientists and they are seeing all the messiness of how science happens." And I'm sure we all remember this messiness. I remember at the very beginning of the coronavirus pandemic, hearing conflicting information about masking and its effectiveness, and also later down the line with vaccines. Perhaps one of the most important lessons learned was that government officials, health experts, and journalists must communicate to the public effectively. During the coronavirus pandemic, there was no concerted, real, organized effort to counter social media disinformation, and experts sometimes damage their own credibility by reversing their advice maybe too frequently. And maybe they could have avoided these self-inflicted wounds by setting public expectations properly through better communication, though hard to say. So a little bit more on the problem. According to Pew Research Center, the public's trust in science and scientists has been steadily declining, markedly so since the coronavirus pandemic. Trust in scientists is 14 points lower than it was at the early stages of the pandemic. The share expressing the strongest level of trust in scientists, saying they have a great deal of confidence in them, has fallen from 39% in 2020 to just 23% today. So not only is trust declining, but distrust is growing. Roughly a quarter of Americans, 27%, now say that they have not too much or no confidence in scientists to act in the public's best interests. That's up from 12% in April 2020. As we're all aware, this disillusionment with science and scientists isn't confined to the coronavirus pandemic era. Numerous surveys and polls have chronicled this pervasive distrust in the US towards science and scientific experts and their guidance on a really wide range of issues, ranging from global warming to healthcare to nuclear power, kind of runs the gamut. So disinformation about science often stems from the gap between what scientists know and what the general public understands. And this is compounded by the strained relationship between science and media. As society grapples with health crises, there's an urgent call for clear, accurate scientific information, even when the reality is often just uncertainty. The coronavirus pandemic underscored the need for accessible, reliable knowledge to rebuild trust in science. And as distrust in science mounts and as society grapples with imminent scientific and humanitarian catastrophes, now more than ever, we need to foster public trust in science and journalism, increase the accessibility of quality science information, and foster better collaboration between science and journalism. As Arthur Kaplan put in Bioethics Today, quote, "We need scientists who see it as their duty to engage broader audiences about their work. We need training of scholars and the public understanding of science, so more informed voices are heard in the public arena who respect science and the scientific method." To address this, we need experts who can not only share findings, but also demystify the research and policy process itself. And that's why we're here today. So before we jump in, just some quick background on the bird flu and what we know. So the bird flu outbreak in dairy cattle has, as far as public health authorities can tell, infected 3 farm workers in the US, all of whom experienced mostly mild symptoms. But this doesn't mean that it will stay benign. There is evidence accumulating among animals and data from other regions that paints a picture of the virus. Some dairy cows succumbed to bird flu, either dying or being slaughtered. Infected terns appeared disoriented and unable to fly. Elephant seal pups struggled to breathe and developed tremors, and infected cats went blind. Let me go back. So while much would have to happen for this virus to ignite another human pandemic, these events provide another reason, as if one were needed, for governments and public health authorities and journalists to prepare to deal with the threat of bird flu. And as we do, we want to be cautious about the lessons we might think COVID left behind. So without further ado, let's get to our panelists, Secretary Wengren and Dr. Patil, the New Jersey Secretary of Agriculture and the New Jersey State Veterinarian. So I'm just gonna toss it over to them. And to start, can you both introduce yourselves and give us a little background on your work and what you're seeing thus far with bird flu developments? Maybe we can start with Dr. Patil and then move to Secretary Wengren.
Good afternoon. If you don't mind, I think I'll let Secretary Wengren to take the lead. He can give you the broad picture of the department before we go into the weeds with animal health and bird flu, etc.
All right. Thanks, Dr. Patel. The Department of Agriculture has a broad range of areas that it covers and protects, and plant industries and animal health are 2 of our critical ag areas of concern. We also do food and nutrition, so the overlap of food production into food by consumers, and then our school and meal nutrition, all the USDA programs that support families in feeding. Most of them come through our department as well. But today we're really going to focus on our animal health industry, the importance of the monitoring that we do, the testing of animals that occurs on farms sort of regularly, and then the emergence of what changed this spring when the West Coast and Central Flyways started their seasonal migration north, and the emergence of avian influenza within dairy cattle, which is something new for us this year, as that kind of crossover hasn't happened. We've always had crossover species sickness with avian influenza because you'll have wild animals interfacing with those animals. So cats that would eat sick birds would end up getting sick. Tends to be one of the more common crossover connections. The human and dairy cattle and human getting sick from infected birds are people really dealing with the animals at a high level of the concentration of the virus. So it's not a person out watching birds who picked up a dead bird who's getting sick. It's somebody who's literally handling thousands of dead birds or milking sick cows and then not being careful with personal protection equipment. and getting sick from that. So we're learning a lot this year, and we count on not just our state veterinarian and our state research labs, but our federal partners, the United States Department of Agriculture, the FDA, the Food and Drug Administration, and our Department of Human Health and Services, both here, our Department of Health here at the state and national. So those are all the federal partners that have gotten sort of involved in this, and what we in agriculture would consider this is an animal health disease and problem and crisis. And then when you see those little areas of crossover, you begin to see how the bigger network all starts to play together to make sure messaging to the public, and particularly from our side, farm workers, people sort of on the front line of the issue, to keep things safe. And then as part of our food supply, making sure the food supply stays safe. So that's where we're at from our department. We're counting on, we don't have it here in New Jersey, to be clear. Avian influenza does come into the state as the migratory birds move through. We tend to see it in wild populations more so than in domestic, though we've had some domestic cases here in the past. And with bird flu, I think that's sort of the other difference between how it's showing up in dairy and birds. It's still highly infectious. That's what the HPAI is, highly infectious pathogen. It wipes out the bird population in a short amount of time. So then the federal government does its quarantine, and they actually do a mandatory removal of living birds to keep the spread outside those populations from happening. So it's an aggressive approach to a highly contagious virus amongst birds. What took so long in the cows was we weren't sure what was making them sick. They were basically having flu-like symptoms. They were falling off milk production. They were less productive than normal. The milk consistency changed, so they started segregating that from the milk supply. And it wasn't until somebody realized, hey, there's a bunch of dead birds around this farm. Let's check for high-path avian influenza. And sure enough, it was found to be in the milk. The strain of avian influenza is very susceptible to heat, so traditional pasteurization takes care of the virus, so it's not ending up in the food supply, even if there was that crossover. But pretty much the federal government has been indemnifying farmers for the milk losses to make sure that nobody's encouraged to hide a health issue on a farm. It's, we'll take care of you, we'll make sure you get paid for your production losses, and the idea is to keep the food supply safe. It pretty much moved up with the flyway as the birds moved north, the disease moved north. We did have a concern in the East Coast Flyway when North Carolina ended up with bird flu. But we found out that was from the movement of cattle. So actually somebody moving infected cattle from an infected region to the state. So that's why transportation and testing of it livestock before movement are all biosecurity measures we take to make sure that animals coming in and out.
Can you both do me a favor? It's really hard to hear you, and I don't know if it's just me, but if there's something covering your microphone or if the microphone is selected, it's really hard to hear. Ed,
sorry about that, and I've been rambling too.
No, you haven't been rambling. It's been great. I've been reading the captions; they're picking it up, but I just want to make sure it's easier for folks to hear. And now that's much better now that you're closer.
All right, maybe I just needed to be closer. So that kind of is the background on how we got here. I'll let Dr. Patel talk about sort of his experience with what we've traditionally done in the state to address bird flu, and then how we've changed things up for the dairy industry this year.
All right. Thank you, Mr. Secretary. So it's a pleasure to be,
Dr. Patel, you're even quieter than Secretary Wengren. I'm sorry. Just make sure there's nothing covering your microphone or anything.
Can you hear me?
Yes, you just may have to project a little bit. Sorry.
Okay, I'll also sit closer. Can you hear me better?
Much better. There we go. Thank you.
Okay. So good afternoon, and I think it's a pleasure to to talk with you all about the work that we do and how how our dedicated employees protect the animal health and the public health in the state of New Jersey. So we are a division of animal health within the New Jersey Department of Agriculture, and as a state veterinarian, I'm the chief of the division of animal health. Within the animal health division, we have different programs that we operate to ensure the protection of animal health. We have field veterinarians and field technicians who do disease investigations on farms and livestock premises. As Department of Ag, our primary responsibility is toward the livestock, and that's what we do in this division. We also respond to any humane complaints against against livestock industry in the state. If there are complaints, we send out our people and they do the investigation according to our rules and regulations to ensure that the livestock is treated according to the minimum standards of the treatment that we have published here in the state. We also work with other state agencies on the emergency preparedness. Emergency preparedness could include any natural or human-made disaster in the state of New Jersey. For example, a hurricane is a natural disaster, and whenever there is a hurricane, there are animals out there whose lives are in jeopardy and need help. And our emergency preparedness, veterinarian and the department employees that are involved in the emergency preparedness, we work to provide the resources and help that livestock and the animal owners they need in the state. We also operate a state animal health diagnostic laboratory. So as part of this lab, we provide testing services to farmers, animal owners, and the private veterinary practitioners out there. They rely on our lab to do a lot of testing. We also work with federal agencies. U.S. Department of Ag is our primary cooperating agency with the federal government. We work with them to manage or operate disease surveillance programs, and the avian influenza or bird flu is one of the important programs that we operate in cooperation with the U.S. Department of Ag veterinary services. So that's a brief overview of the animal health activities that we do here for protection of livestock health and public health, as well as food safety. Again, these days I'm sure you all have been hearing about One Health. One Health is a concept that started about 15-20 years back, where all the health stakeholders, they realized that we all need to work together to improve health and well-being of all the animal species as well as the environment, because we all are interrelated in terms of the environment that we share, the food we eat, the pets that we have, the livestock that we rely on for production. All this is connected. Human health, animal health, environmental health is all connected, and that's why I think we are participating in One Health type of initiatives within the state as well as in cooperation with federal governments. So that's really a brief introduction. Now coming back to bird flu. Bird flu first was seen, the current strain of the bird flu was first seen in the United States in early 2022. That's when several poultry farms they started getting the infection and seeing high mortality. And since then it has been identified in almost every state, more or less. And as the name of the disease indicates, highly pathogenic avian influenza. This particular strain of the bird flu is extremely pathogenic to its bird host, and it is it may or may not be pathogenic for wild birds that carry them. Depending on the species of the bird. Some bird species they die, some they don't, and they just carry it with them. To different areas around the world, and that's how it spreads. And when these wild birds they actually commingle in their breeding areas down south or up north. That's when they actually transmit these viruses to each other. And that's how this bird flu has been spreading. So that's somewhat about this current strain of the HPAI and how it is spreading. We working with the USDA, we have a very strong surveillance program in the state of New Jersey. We have inspectors who actually go out to poultry farms and markets. And they actually collect the samples and we do the surveillance in the lab by testing those samples. So we have been proactively working on this disease since last 15-20 years, almost 20 years. And whenever there is a bird flu outbreak, we respond and we take care of the problem and we prevent its spread. We have been very successful in New Jersey so far in containing the bird flu outbreaks. Again, it's really important for people to know that we have rules and regulations in place to prevent the spread of diseases like this, as well as to make sure that the commerce, the animal health industry, and the commerce is conducted in a safe manner for the sake of animals and public. And any import of birds from out of state, we have rules that people must follow, including and testing and the certification requirements. We have rules that must be followed when people are moving their birds from the farms to places where they are sold, like markets and auctions, where they must be tested. And we are always out there educating the farmers and the public about the disease and the biosecurity. The importance of biosecurity cannot be ignored. Biosecurity means making sure that you are taking measures to prevent the spread of the bird flu or for that matter any infectious disease from one farm to another farm. So these are some of the important points I hope that that you all will emphasize to public out there.
Thank you. Oh, is there
That's weird.
all right. Okay. Seems good now. So just a follow-up question. We'll start with with Secretary Lundgren again, and then move to Dr. Patil. What do you think journalists should know specifically about covering the bird flu? I'm thinking about like, how do you balance the need for direct and accurate information with a responsibility not to spread unnecessary fear? Do you have any thoughts there?
So I think it's It really starts with talking to the experts. So forums like this are great, but also having access to good information is really critical. Understanding that the risk to humans in this case and instance is minimal. The food supply is safe. Like I said, FDA has done pasteurization tests at all different temperature levels, and really any low-level pasteurization will ensure that the virus will not pass in an active form to humans. I think understanding that even when humans have been exposed and gotten sick, it's been really mild symptoms. So you think about really contagious within the bird population. Cows got sick, got flu-like symptoms, recovered, and 6 weeks later they're kind of back to normal and no longer carrying the virus. And then people exposed to that even less so. I think most of the cases have been conjunctivitis, which is basically pink eye. And you think about children in daycare get pink eye from each other. So that's about the risk of spread amongst human interaction. But it doesn't mean that a virus, as we learned with COVID, isn't going to mutate and change. And that's why we want to limit the exposure between farm animals, people, and products. So counting on the experts, talking to knowledgeable sources of information are some of the best things reporters can do to stay engaged and informed the public.
Dr. Patil, do you have any thoughts or an expansion on Secretary Wengren's statement? Like, what do you think journalists should know about covering bird flu?
I think it is important to rely on the experts, the scientists, that are doing research, the animal health professionals, who are working on disease control and prevention efforts, through collaborative approach between the state agencies, the federal agencies, and our researchers in the universities. We have learned a lot about the virus. Of course, there is always more to learn about the virus. But last 2 years, we have done a lot of research and we have collected a lot of experience about the disease in the field, and based on that, it's important that that we make decisions and we talk about diseases, considering that information. For example, as we all know, that perhaps in certain sections of the community or the society, maybe people are really scared that bird flu could become next pandemic, and they are probably I don't know stocking on supplies or not, but I don't think that is warranted. But anecdotally, I can see online, that people are, some people, are panicked. But in my opinion, based on what we know about the virus and how it is spreading and how it is behaving, it is still a low risk to general population. This virus has not, shown, tendency to spread, between people to this point. Now we have seen that this virus is actually highly pathogenic to different animal species, especially the wild species, including the wild mammals as well as sea mammals. We have seen that throughout the world. At the same time, we have also seen that in cattle, it causes a brief illness that lasts like 2 or 3 weeks, but it does not really cause high mortality in cattle. It's mostly fever and effect on the milk production, and and then like 3 or 4 weeks later, these cattle may or may not recover, but they don't necessarily have high mortality. And as Secretary said, the human infections to date, they are limited to farm workers, who handled really high amount of virus. Just by picking a dead bird, you're not going to get this virus. But poultry workers or dairy farm workers, who are handling these birds, infected birds, literally hundreds or thousands of these as part of their occupation. When you handle that kind of high load of the virus, and depending on the practices, etc., biosecurity practices, etc., there could be human infection, and so far all these infections have been mild conjunctivitis, they have seen, and maybe mild upper respiratory disease symptoms, and the studies conducted by the USDA and the university researchers, so far, it has shown that this bird flu virus is not really silently spreading between people. It's not. They did a study in Michigan on the dairy farm workers, who actually have worked on the infected dairy farms, and they found that there were no antibodies to this virus in the blood of these farm workers. So although these workers, they handled infected cow and the milk, and they worked with them, looks like they did not get infection, and there was no silent spread without any clinical signs. So that's really a great news, that we all should keep in mind. Again, it's also important for journalists to realize that in science, nothing is static. Nothing is permanent. Probably Newton's law. I think that's permanent mostly, and some of the fundamental laws of gravity, etc. I think those are permanent. But when it comes to infectious diseases, these diseases, they could mutate. They could depending on the host, interaction between the host and its environment, they could acquire new host. That's why scientists are always on top of their research. They're always studying these things. They're always studying these phenomena to make sure that we are always up to date with the new developments, new information. So just because a scientist told you last month that don't use mask, and today he is telling you use mask, it doesn't mean that he's or she is flip-flopping. It's just that there is new information being made available through research that we need to take into account. I think that's what I would advise.
Thank you for that. I'm starting to see some questions come in through the chat, so I will turn to those. Is there a bird flu vaccination for humans? Can it be prevented in humans?
So they are working on bird flu vaccines, but mostly for the bird population, because it hasn't been a human virus. The research, again, this is the research of vaccines, and vaccines are controversial with some people. But I will say they're working on a bird one. Then from there, they work on, will this also work on humans if humans need to get the vaccine? Again, the way the virus has been showing up in humans, it's mild. So I don't think there's a need for the general population to get a bird flu vaccine because it hasn't hit a serious sickness level where that would become something the way I'd still be more worried about the regular flu than bird flu. But I think the science is FDA and the drug officials are working on that the same as they are with the animal approach to it. Could we give our chicken and poultry producers an option to treat their birds to be prevented from getting disease so that they don't have to worry about depopulation if it does show up in their
area? Dr. Patil, do you have anything to add, or should we move to the next question?
Just one thing I would like to reiterate that it's really important to take vaccine against seasonal flu. The flu virus, they are constantly mutating, and they are reassorting with each other. So if a human is infected, let's say by a seasonal flu and bird flu, it is possible that virus might reassort in that human and create a new mutation of the virus that could be more or less deadly. You never know. So it's important that that seasonal flu vaccine is taken by people. And as far as vaccine for humans for this particular bird flu, HPAI H5N1, as Secretary said, there isn't one right now, but recently a CDC they said that the previous version of the bird flu H5N1, they have some experimental vaccine, and based they think that this experimental vaccine could work on this new strain of the bird flu in people. But again, the research and the studies are ongoing, and we have to rely on information that will come out of CDC regarding vaccines for people. So
Thank you. So another question from the chat: is there any specific threat to poultry farms in the Midwest or the US, and what could be worse impact on and what's the impact on meat and egg production, and is there any solution to minimize the risk?
So I think that's this is the nervous time of year for the East Coast flyway. We tend to see bird flu as the birds come from the mating grounds up north in Canada in the summer, where they all mix and mingle, East Coast flyway, Central flyway, West. When they head south on the East Coast flyway is our sort of biggest risk for wild bird introduction of the bird flu to the region. So this is where our Department of Fish and Wildlife over at DEP are monitoring the wild bird population. So they're on the lookout for dead birds. Crows seem to be one that are more susceptible than some of the other bird species. So we look for dead crows. We look for certain waterfowl that may be native to here that got exposed to the waterfowl coming south from the north. So that's one of our early surveillance things. We watch our live bird markets and our poultry markets. We alert our farmers to be on the lookout, reduce that exposure of wild birds. Don't leave your feed out exposed where a wild population could come land, and then your animals or your birds are mixing with the wild population. So using fencing and netting to keep them separated are all things we encourage our farms to do. So I think that's this is the high alert sort of season for us and everybody, because we've been dealing with it for a couple of years in production agriculture. Our farmers are all a little more careful this time of year with storing feed, storing supplies, and making sure the wild population, the farm doesn't become an attractive destination for the wild population to land and interface with their animals.
Dr. Patil, do you have anything to add?
Could you, please repeat the question?
Yeah, the question was, is there any specific threat to poultry farms in the Midwest or US? What's the impact on meat and egg production? And is there any solution to minimize the risk?
again, as just adding to what what Secretary said, the wild birds, they are certainly the threat, that brings this virus to United States. Uh, Now, there was a brief impact on egg production back in 2022 because of this virus. But since then, we have recovered from that impact. There isn't, like a very severe impact on milk production either, especially because, Food and Drug Administration and the USDA, they have collaboratively they have shown that the pasteurization of the milk is very effective in killing this virus. So there isn't a threat to public health through consumption of milk at all. But
I'll say the same for the meat side of it, things.
Yeah.
If you're properly cooking your chicken, even if the bird may have had the virus, it's not going to translate to humans because heat destroys the virus. And like we've said, the pasteurization tests were at like 130 degrees and it was killing the virus. So think about anybody cooking their meat to 160, or you're pretty much safe. Like I said, the animals eating raw meat tend to be the ones who would get sick from a sick animal.
Okay. Another question from the chat. What factors have contributed to the recent resurgence of bird flu in New Jersey?
So we haven't had cases this year. We've had a few wild population bird deaths that Fish and Wildlife traced, and it never spread beyond that this year. In the past, I know Dr. Patel, we've done some removal of some animals from some smaller farms. More backyard flocks are sort of our risk and threat level. So because again, they may not have the resources of a larger farm to make sure the wild birds don't mix in with their backyard flocks. So that's one of our risk threat areas, but I'll say it's going to be end of August as the northern migration heads south, that will go on high alert to make sure our farms are safe. Where we have live bird markets in the state of New Jersey, the Department of Agriculture and the bird market operators are on a regular cleaning process where they shut down for a couple of days, everything gets sterilized, cleaned up, and that's one of the best ways the state does at preventing infection within those markets, so people can safely acquire those animals, whether they're going to use them for production or for cooking and consumption.
Yeah, I definitely agree with the secretary there. We haven't seen bird flu this year in our poultry industry, and the last wild bird positive we have seen was early spring. Since then, the wildlife agencies they haven't reported any HPAI in wild birds, and again, our surveillance program is very strong. Our partners at the federal level, U.S. Department of Ag and us, we both are on ground in New Jersey. And we are looking for sick birds. We go out, we do surveillance testing. All that is happening routinely. So hopefully hopefully it will remain that way, and I'm knocking on the wood here. So
another question from the chat. Under what circumstances can a person become infected with bird flu? And this one is for Dr. Patel.
So as we said, in one of the previous questions, if currently, this bird flu is really, an animal health event. It's not a public health or human health event. But, we have seen that, poultry or dairy workers who handle, high load of the virus, such as, infected, hundreds or thousands of infected poultry, when they handle, the virus, in that high amount, there is a possibility that, they will, get this infection. But again, the infection that poultry and dairy workers, they have gotten, it's mostly been wild. So to my knowledge, there have been 4 dairy workers that were, infected, that have been shown to be infected, and about maybe another, like a half dozen, or maybe half dozen dairy workers and 4 poultry workers. So it's really, less than a dozen people infected, and all of them, they have shown, very mild clinical signs like conjunctivitis and upper respiratory, clinical signs. So I think, I don't think, this virus currently, has that ability to, transmit between people and cause, severe disease in humans. Here, we haven't seen that here in the United States. So
Thank you. Another question from the chat. During the foot and mouth disease outbreak a few years ago, it was reported that many Koreans who consume meat as a staple food in the US continued to buy and eat meat because many of them didn't know, and also due to misinformation about the disease. With the bird flu, what is the communications plan of government agencies to prevent this from happening? And that ethnic communities, given the language barriers, would have immediate access to this information.
So the state is in the process of getting ready to make a landing page for everything high-path avian influenza. I keep calling it AI, and people keep thinking artificial intelligence, and we call it bird flu or AI, avian influenza. So we've been working on that with our partners at the Department of Health, Environmental Protection, and us here at Animal Health and the Department of Agriculture. So expect that to go out this week, and the forms within that, all state forms that can get translated into other languages, those versions will be there as the translations happen and get posted. So the idea is to have that page up and running for the public to be aware of, and to be the landing page for all the new and updated information we get. Again, I will say the federal government has been very good with infected birds not going into the food system. They're literally destroyed and burnt or buried, composted. There's 3 ways to do that. And the idea is to get the live virus out of the food stream as quickly as possible. So that would be our big source of information, and it would be alerted through the governor's office and our offices if something were to happen. If it was going to happen within livestock, it will come from our office. If it's going to be impacting people, it's going to come from the Department of Health. But we'll all be doing this cooperatively to make sure the public, to the best of our abilities, is aware.
So just to be clear, the question probably was asked in context of finding a foot and mouth disease, not in the United States, because we don't have foot and mouth disease in the US, and it hasn't been here for decades now. So it's likely, I think, that the question was referring to the outbreak in the United Kingdom in early 2000s. So just to clarify that, we did not have foot and mouth disease outbreak in the US.
Okay. There's just about 8 minutes left. So if anyone has any more questions, feel free to put them in the chat or raise your hand. You can ask them yourself. But with that in mind, do you have any closing remarks or any statements or facts that you just want to make sure are clear and hammered home before we close the panel?
Well, with no further questions, I would say we got a what risk does it pose to other birds and animals? It's the same, I think, as any other contagious disease. If you're exposed to it, you're at risk. And that's really what we're trying to do on the agriculture side, is to protect the domesticated flocks from the wild population that's carrying those viruses. So keep that separation. And as we talked about biosecurity, those are important things. So somebody who has backyard chickens in the state of New Jersey, and we know there are plenty of them, you want to make sure that the wild birds aren't coming and eating next to your chickens, that when you're putting out food, the food is going out for your animals, and you're minimizing that exposure of a wild population to a domestic population. So that's where it really begins. And then if your birds do get sick, it's contacting the state veterinarian, calling the department's phone numbers to make sure that they can be reported, they can come out. Because what you want to do is make sure, did the bird die of old age or did it die from flu symptoms? And then to watch your other birds in the flock. Do you start to see the watery eyes, the running, the kind of weeping symptoms, that breathing difficulties, all those things that would come from a flu-like symptoms. And if you're seeing that, again, talk to your local veterinarian who helps you take care of your animals, and then really notify the state vet if you don't have that kind of relationship with the veterinarian. But the idea is the sooner you know, report it, and then we can get to the bottom of it to prevent a bigger outbreak.
Dr. Patil, do you have any expansion or anything to add?
Yeah, I agree with the secretary. Again, it's very important that the Division of Animal Health is contacted if there is a suspicion of bird flu, or if there are sick birds dying, especially the poultry. When it comes to reporting wild birds, I ask that people report them to Department of Environmental Protection, Fish and Wildlife Division. So between us and them, we work cooperatively. So they work on wild bird side, we work on the domestic poultry side.
Great. So we just have 4 minutes left. Any closing remarks from either of you? Anything in summation that you just want to get clear?
Sure. One, we don't have bird flu in the state currently. Two, we are doing everything we can to make sure we don't, but it is a natural occurring and moving virus. So we count on biosecurity. The steps we take are there to secure the food supply, to make sure it is safe. So if birds do get sick in a domestic flock situation, they are kept from the marketplace. They are destroyed and removed. So there is no contamination of the food supply that way. But if something did slip through, improperly cooking the food will take care of the virus. Same with dairy and dairy cattle. That's why we're watching that industry closely. We have about 40 dairy farms in the state. All of those farms are doing everything they can to prevent the disease getting into their farm and farming operation. We do have a concern of like some of the central states like Colorado, where dairy farms also raise chickens. A lot of our dairy farms are raise chickens as well as dairy, beef, and other livestock animals. So they're all doing the best they can to make sure there's no cross-contamination and separation of those species on the farm to prevent any of that. You'll know this if you're one of those people who attend our county fairs throughout the state. They've been avoiding bringing the lactating cows to the fairs. So you're seeing a lot of heifers and young calves. You're seeing bulls and beef animals. But the more susceptible milking dairy cows the dairy farmers are choosing to leave home on the farm to prevent that opportunity of the disease either coming from the fair or bringing it to the fair and exposing it to other farm animals. So I think everybody's doing the best they can on the biosecurity front, and that's the first line of defense we all have here in New Jersey.
Dr. Patil, anything to add?
So, yeah, so I echo what Secretary, Van Green said there. Biosecurity is very important, ensuring that, the visitors to the farm are limited, the conveyances and the vehicles, they are cleaned and disinfected, between the visits. Equipment at the farm level is cleaned and disinfected. All those are examples of, a good biosecurity. Again, we do have several, live bird markets in New Jersey that are of, operated by people of, ethnic origin, and my message, is really, make sure that, you are following, the rules and regulations that we have put in place to prevent the introduction of, bird flu into the live bird markets, as well as, into our, poultry, farms, and working together, with state and federal agencies, we have been much successful, and with cooperation of, the people, I think, we would like to, really, keep it that way, keep bird flu, out of New Jersey poultry.
Right. Well, that brings us right to 3 o'clock sharp. Thank you both so much for participating in this panel discussion.